Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Wednesday, May 13th. Yesterday, I mentioned that on a going forward basis, we would be describing new cases of COVID-19, hospitalizations, and other data points as represented by the 8 counties in our region as defined by the Regional Economic Development Council. And if you look on the screen right now, we're showing you a map of the 8 counties that I identified a couple days ago. One more time, they're Warren and Washington, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene. There's another graph that we're going to show you, and this one we're going to also show on a going forward basis, and this will represent 2 different data points as represented by hospitals or patients from those counties, those 8 counties.
That's right.
The blue grid, the blue line is the number of hospitalizations of people with COVID-19, and the yellow are the patients who are in the ICU. And what you can see is this starts back from March 6th. It hit the highest point on April 10th, and today we're representing 104 people in hospitals in those counties in beds and 31 in ICUs. And Fred, I think that number's been coming down.
It has been. When you look at the graph, you can see for more than a month now, there's been a steady downward trend in both total as well as ICU patients. Very good trend.
And we'll continue to put this grid up, and we'll begin to orient you to this grid so you can see what's happening not just within Albany Medical Center, but graphically what's happening in the region as well. The next graph is one that we have shown before, and I think you are familiar with this one. This has several data points as well. This data is just the data from Albany Medical Center. The blue lines above the middle horizontal grid represent new cases coming into the hospital, and below the line are either discharges or people who may have died from COVID-19. And what you can see yesterday is that we admitted 1. We had 3 discharges, and we didn't have anybody who passed.
That's right.
And so the purple line, which represents the hospital census, is going down, and this is obviously a trend that we're watching as well.
And again, if you look back over the total time period, we peaked somewhere in the end of April and have been on a downward trend since.
So the current numbers in the hospital are 51 patients inside Albany Medical Center, 40 are on the floor, 11 are in ICUs, and 8 of them are on ventilators. The waiver process. Fred, we've spoken about how originally Albany County was a county that was not allowed to start doing elective procedures. We had to go through a waiver process. We've spoken about how that was a process that you led, and we were able to start doing elective procedures, what we like to call medically necessary procedures, earlier this week. But we have some new information on this.
That's right, Dennis. So we did start at South Clinical Campus on Monday and have done cases Monday, Tuesday, and today at that campus. The state always intended to refresh the data upon which they decided which counties could open and which could not. And actually that data has been refreshed as of today, and we've been told now that all the counties in the state, with the exception of Erie County out west, the New York City counties, and the Long Island counties, are cleared to do elective or what we consider medically necessary surgery. So all of the counties in our region now are eligible to start. So we can start now at the main campus, and we can also start in Niskayuna. We've been planning for that right along, so we will finalize those plans today or tomorrow. And my expectation is we will start to slowly ramp up in all our sites on Monday.
So there will be more capacity within our Albany Medical Center system in order to do those elective procedures.
That's right, Dennis. And the criteria that the states used is greater than 30% of bed capacity available, both ICU and total, as well as a declining census, which we have seen on the graphs. That's been going on for quite some time. So this is good. This is good for our patients. We're going to be able to do more of that medically necessary surgery.
That is great news. And let's remind ourselves the difference between what we're talking about right now, which is the ability to do these elective procedures inside hospitals, versus another discussion point, which is how to open up the region economically. And that's a different set of criteria. Yes. That's the one the governor talks about, where there are 7 criteria. Many of them are medical data points, and you have to be 7 out of 7 for the region to open up. And we're going to hopefully hear more about that. We
we'll
think
talk
that
about that.
currently there's 5 out of 7 that this region meets.
But we'll talk more about that later in the week.
Excellent.
Yep.
Okay, thank you very much.
Okay.
Fred, today we're wearing faculty practice shirts. We've talked about this in the past. You led the faculty practice for many years. And the reason we're wearing this is because yesterday we spoke about safety inside the hospital, but there's a lot of things that we've been doing from a safety standpoint in the practice.
Absolutely. So the faculty practice is a very important part of the medical center here. We have over 500 physicians and hundreds of advanced practitioners that work in the practice, critical to what we do. The practice leadership actually did a survey. They had a local group send an email survey out to almost 60,000 patients, and about 6,000 responded. And there were a bunch of questions that we asked in terms of what their concerns were about coming back for medical care, and frankly, what could we do to make them feel safer. And I want to just make 4 points. The patients who responded were very concerned about how clean our facilities would be from a disinfection perspective. They wanted to be sure that social distancing would occur within our offices, that our staff and our providers would be screened and masked, and that patients would be screened and masked. And all of that and a whole lot more is going to happen, is actually happening in the practices and will continue to happen as we go forward. Actually, practice leadership today shot a video, and they're going to talk about all of those elements and more. So that'll be out shortly for people to see. But we're listening to our patients, and we want to address their concerns as well as their medical care.
That's wonderful. We look forward to seeing that video. One way to objectively measure safety would be to say how many members of our workforce have had COVID-19 and how does that compare to the general public? And is the environment they're working in any more or less safe than in the community? And I think we have some data points about that.
We do, Dennis. You can actually go on the DOH website and see the percent of people who've tested positive in a region. And it turns out that the percent of our employees that have been tested and are positive is basically the same as what is the percentage in the region. There's no difference. So you're as safe in our facility as you are out in the community.
That's a very good message to send, and I think it's important for people in the community to hear that, and we'll continue to emphasize that as well. We'll be back again tomorrow. We're going to continue to talk about safety. We'll certainly get an update on the procedures that we're now going to be able to do on this campus as well as Niskayuna, and we'll talk more about the region as well.
Yes.
All right. Thank you, Fred. That's it for today. We'll be back again tomorrow. We ask that you once again please take care of yourself, take care of each other, and we'll see you tomorrow.